Kupuna Connections television program. I'm Cullen Hayashida. I'm the director of the Kapi'olani Community College's Kupuna Education Center. And on a weekly basis, as you well know, we provide this important community service by having information having to do with elder care, information for our families and our active retirees about seniors and senior lifestyle. So today we have a very important topic to talk about, and it's about Alzheimer's disease. Alzheimer's disease, what's the latest updates in 2014? And with me is Dr. Cory Leo, and welcome, Dr. Leo.
Thank you.
And perhaps we can start off with you sharing a little bit about who you are and what do you do.
Well, thank you for having me here, Cullen. And my name is Cory Leo, and I'm a neurologist, and I direct the Hawai'i Alzheimer's Disease Center at the Hawaii Pacific Neuroscience. We are a group of multi-specialty physicians consisting of neurologists, geriatrician, neuropsychologists, psychologists, psychiatrists working together to care for the dementia patients.
Oh, okay. And this is located where, did you say?
We're located in Kailua in an office building right next to the Castle Hospital.
Oh, okay, okay. So that's the general, so people have a sense with regards to where we're talking about. But you're serving a very, an important population, and of course a very important issue with this growing population of older adults. We're talking about Alzheimer's disease today, and of course there are others that have talked about different kinds of dementia. And so maybe we could start out by getting some clarification as far as what is Alzheimer's disease, and is this one of many types of dementia? What can you share with us about this?
Well, Alzheimer's disease is a type of dementia, while dementia itself is a neurological disorder that predominantly affects the memory function of the brain. That's severe enough to affect the activities of daily living. So there are other types of dementia besides Alzheimer's. For example, there are certain types of dementias that are treatable, dementia caused by stroke, dementia caused by the wrong medications, hormonal disorder, vitamin deficiencies. Those are potentially treatable and reversible types of dementia. There are also other types of chronic dementia like Alzheimer's, but they're very different, important to differentiate from Alzheimer's, like vascular dementia, patients with progressive stroke, or frontotemporal dementia. These are patients with predominantly trouble with the language, Lewy body dementia, patients predominantly trouble with hallucinations, abnormal breathing, dreaming, So it's really important for us as physicians to make the right diagnosis, because they are all treated differently, and especially early on, to help the families know the different types of dementia and how to take care of them.
Oh, I see. We had this one slide that you provided us with, and perhaps this could kind of give us an idea with regards to what we're looking at here, yeah? So Alzheimer's, according to this, is what, 60% of the dementias are of this type, would you say?
Alzheimer's is the predominant dementia type, especially in the mainland U.S. However, there are certain regional differences. For example, if you go to Japan, vascular dementia from stroke risk factors is actually the predominant dementia type. So in Hawaii, we are kind of in between the two. So we have a lot of what we call mixed dementia, pictures of Alzheimer's and vascular type mixed dementia. So again, the diagnosis is really important. It helps your physician in determining the type of treatment, and it also helps the family to understand what's happening to the family members and what to expect and how to take care of them.
Yeah, I think you made a very important point about the fact that some are modifiable and others are not necessarily modifiable as modifiable. Yeah, and I think maybe we cannot simply say, well, it's due to old age, and therefore it's Alzheimer's necessarily. It's important, as you pointed out, that we got to do some diagnoses.
Well, a lot of people say that, well, maybe, this is just a memory loss, this is just aging, this is just normal. But there's really, Colin, there's really major differences between dementia memory loss and normal aging memory loss. We all have a little bit of senior moments. We forget some dates, some where I parked my car, But there's major differences between forgetting where I parked my car and not knowing how to drive home.
Yeah.
So some of the early signs of dementia includes memory loss that are very significant. People asking the same questions, forgetting important dates, forgetting names, just forgetting where they place things. So those are some of the early signs to watch out for.
Yeah.
And again, there are major differences. We all tend to forget a little bit. Those are normal aging. But when it comes to dementia, those are differences that are very important to sort out by the physician.
Right. I know sometimes I've had a situation where I forgot where I parked my car, over at the University of Hawaii in the multiple, parking lot. Called security, and it was on another floor, Obviously, they were not happy with me, but
that's what the red button is for.
Yeah, so it does happen, so we got to be careful.
Oh.
It affects everybody. But let's talk about prevalence, in terms of, you have a graph here that you shared with us, and I thought maybe we could have some explanation with regards to what are we looking at here.
Well, absolutely. Alzheimer's dementia is the sixth leading cause of death in the U.S. It affects about 5.4 million Americans. Unfortunately, the incidence is increased, as you can see from the graph, that as the baby boomers ages, we estimate that the incidence will double every 20 years. And the fact is that it's estimated every 69 seconds somebody will develop Alzheimer's dementia in the U.S. And if you're over 65 years old, your chances is 1 in 8. If you're over 85 years old, it's 1 in 3 people will develop Alzheimer's. And if you're over 95, so it's 1 in 2. So age is clearly a significant risk factor for developing Alzheimer's dementia.
Yeah. Now, in that graph there, you had one dark line, and you got that yellow band there. So it's like that upper and lower estimates then, I guess. Huh?
Absolutely, and a lot of things could change. For example, if we are able to modify some of the risk factors, we're hoping to reduce or delay the onset of Alzheimer's dementia. Even it's estimated that even if we could delay it by 10 years, in the general population, there would be significant cost savings for the nation.
Absolutely, yeah, absolutely. Any estimate with regards to how many people in Hawaii we're talking about?
Well, in Hawaii alone, we estimate there's about at least 30,000 people with Alzheimer's dementia. However, several studies have shown that this is about 30 to 50% of cases go undiagnosed. So the incidence is really a lot more than that. And we're just barely scratching the surface. And as you know, many times these diagnoses are not made, or the family may be in denial, or the primary care physicians may feel that, well, there's no cure, there's nothing that we can do. Why make the diagnosis?
Yeah.
So this is really underestimated.
Yeah. So there's a lot of education even among the physicians that's necessary, I guess. Huh?
It is, and we're really, really excited because we're partnered up with Dr. Kamal Masaki at the Department of Geriatrics at the University of Hawaii, as well as Dr. Westlam at the Executive Office of Aging. We are doing a brain education initiative for Hawaii, where we're targeting younger physicians in training, the residents and medical students, and primary care physicians in educating them on the primary signs and symptoms of recognizing the dementia and the basic workup. So there is a lot of effort that's going on, and the community is really coming together to make this happen.
Fantastic. Now you mentioned signs and symptoms. So we have some slides here also with regards to this whole question, with regards to, what are some of the signs and symptoms of, with regards to the early warning signs that we should be looking out for?
Well, it's the earliest signs are probably just difficulty with memory.
Memory.
Just trouble asking the same question. Where are we going? or grandma may be forgetting some important dates, going to see the doctors, forgetting important dates and perhaps forgetting the names of their grandchildren. Those are very early signs. Later on, other things may start to develop. There could be personality change. There could be social withdrawal as they are having difficulty relating to their friends. But I encourage our viewers to go to alzheimersdisease.org or the Alzheimer's Association Aloha chapter to look at the top 10 symptoms and signs of Alzheimer's disease listed there.
Okay, so what we showed on the first slide there that you were looking at were the first 5. So we got the second 5 in this next 10 here. Things, I guess, as you see, misplacing, and you want to kind of comment on some of these things?
Yes, absolutely. And the one that I really want to point out with is loss of initiative. For example, grandpa who likes to do yard work, or grandma who likes gardening may suddenly withdrawn and just shows no interest. Those could be early signs of what we call vascular dementia. So our viewers may not be aware. They may think that grandpa is just, but loss of initiative. Other things like behavioral mood changes could be early signs of frontotemporal dementia. We may have, for example, we had an attorney who is a very religious person, a very proper person, misbehaving, having an affairs and misusing the finances. Those are early signs of personality change, behavioral change. Those could also be early signs of dementia, like frontotemporal dementia. So our viewers should really be aware that dementia doesn't just present with memory loss. They could also present with other things, loss of initiative, mood, behavioral changes. So it could present with many things, and they should really seek the medical advice, see their doctors early on.
Okay. Now, when you are, let's say if one were to notice this in your loved one, and you say, gee, I think, we need to go and see a psychiatrist. Well, probably red flags will come up, or how do you, what's your recommendation as far as how best to approach something of this sort?
Oh, that's a great question, because your loved one is probably going to get very anxious. What do you mean? I don't want to see the doctors. I don't have dementia. This is a a name that I don't want to be associated with. So it's really important that whatever that we do, we always cover it with a lot of support and tender, loving care. The goal should be, grandpa, we're just going to get you checked out. Grandma, we just want to make sure that everything is okay. We're just taking you to the doctors. And at the Alzheimer's Disease Center, our doctors and staff are trained specifically to be very sensitive to this issue. We are very careful about putting labels, and whatever we do, it is always do in the context of a very loving environment, caring environment. We're not here to label them, but we're here to do some homework to find out, and we're here to support the family. We want to find you the right resources on how to deal with certain things, or perhaps this is not dementia, perhaps this is something that's treatable, perhaps it's a hormonal issues, treatable. We want to get you the right treatment. So you just hit a very important point. Thank you for bringing that up.
Now, here's another situation where, let's say, you say, well, mom's acting a little bit unusual and forgetful, and is asking the same question multiple times, and maybe it's really, really early. Is it really necessary to come in when it's, an early diagnosis? What do you say to that?
I would, this is a challenge that we face as a community of physicians and researchers and scientists, because most of the treatment that we have right now is not curative. We do not have a cure. We do not even have treatment to stop the progression of Alzheimer's. Our treatment right now can only slow the progression of Alzheimer's. And part of the challenge, and I share my personal feelings, and this is shared by many scientists, physicians around the world, is that the clinical trials on the current therapies that is available right now is tested on patients who are already diagnosed, patients who already have dementia, where their brain has already had the abnormal buildup of proteins. Our goal should really be testing patients earlier on before the buildup of the proteins. So that's when we have the best chance, the best opportunity to make a difference, to slow, even stop the buildup or slow the progression or even stop the cascade of events leading to buildup protein. So my preference would be for this, for early diagnosis, early accurate diagnosis, and also it allows us as a community of physicians and researchers to test new drugs earlier on in patients yet to be end stage, yet to be, we would really like to work on these patients.
Mm-hmm, mm-hmm. There's, I guess many of these medications may not have that much of an effect at the later stages, I suppose. But you're suggesting that start early and possibly the impact on that early intervention would be probably better.
I get very excited when patients are coming in at the early stage rather than later stage, because at the very late stage, there's really not much in terms of medications and intervention that we can offer, except for supportive care, modification of behavior, calming the behavior down. By that early stage, there is so much that we can do. We can consider them for clinical trials, and we can consider them for preventive therapy. There's a chance to alter the way that they live, the food that they eat, the lifestyle that they live. So we're excited when they come to us early. It is really our goal to get these patients early so we can make the greatest impact.
Mm-hmm. The potential is much better. Huh?
Absolutely.
Absolutely. Okay. Let's then now talk about therapies. We're sort of implying, this whole discussion with regards to intervention, early intervention. What can you share with us with regards to some of the present approved therapies that exist right now?
Well, there's presently no cure for Alzheimer's dementia. The medications that we have right now, it doesn't really address some of the underlying cause in Alzheimer's dementia, which is the buildup of abnormal proteins in the brain. At this point, the medications, what we call cholinesterase inhibitors, like donazepam, Exelon, Aricept, all these medications are just chemicals that helps the brain cells to continue to communicate with each other, because these proteins basically interrupt the communication between the brain cells. So these medications may perhaps slow the progression. It is not a cure. It doesn't even stop the progression. So, but we are really excited because there are several other clinical trials that are addressing more of the basic problem underlying this, which is preventing the buildup of these abnormal proteins that may work on the enzymes that blocks the generation of these proteins. So there are several clinical trials that are going on right now that we're very excited about. That's going on that hopefully will lead to better treatment.
Maybe you can share a little bit more about what these clinical trials are about, to our lay audience, of course. I recall some time ago some discussion about a vaccine, and I'm not too certain to what extent that has continued to go on. But what can you share about some of these new clinical trials? Where are we going with this?
Well, there's several challenges, but there's also several exciting developments in the clinical trials. For some of the challenges is to find these patients early on and not late on, because we know that we have the best chance to make a difference early on in the stage of the Alzheimer's. So one of the challenges is, how do we identify these patients? So we're focusing our efforts on imaging. For example, we want to take better pictures of the brain. We want to be able to see the proteins. There are new PET scan, for example, able to look at some of how these proteins are being built up, that allows us to detect these proteins early. And also genetics is also helping us to identify certain patient groups. There are certain patient groups that are early onset Alzheimer's. They have very specific genes that we've isolated that allow us to isolate these patients. And the exciting thing is the National Institute of Health in the Department of Health in the U.S. Partnering with, there's a concerted effort lately with the industry to develop some of these new treatments, bringing Alzheimer's Disease Center together, and nationally as well as internationally, bringing patients together for some of these clinical trials. The vaccine trials are still underway. There are several other exciting trials working on enzyme pathways. There are exciting trials working on inflammation, working on antioxidants. So those are really the exciting trials to watch out for. And so far, right now, none of the trials are unfortunately available locally in the state of Hawaii. There are patients who are traveling to the mainland for some of these trials in big centers like the Mayo Clinic or UCLA. Part of our goal at the Hawaii Alzheimer's Disease Center is to bring some of these trials to the island so that our local Hawaii residents could benefit and not have to travel to these trials.
Oh, so we don't have any local clinical trials going on here in Hawaii.
Well, we don't have any therapeutic trial.
Okay.
There are several clinical trials. For example, we are doing a clinical trial on a medication to modify the behavior, the agitation in patients already diagnosed, probably moderate to late stage Alzheimer's, to modify the behavior, to calm them down. So we do have clinical trials modified towards that. We do not have clinical trials that are specifically targeted to what causes the Alzheimer's dementia on the island. Right now, we do have clinical trials that are looking at how perhaps the lifestyle changes could alter, slow the progression, delay the onset of Alzheimer's. The data is very early, but we are very intensely looking at this because this is really the easiest thing to do. For example, like heart attack, if we eat less fat, if we do more exercise, we can prevent heart attack. We believe that whatever is good for the heart may also be good for the brain. So one of the clinical trials that we're doing, working with the University of Hawaii, working with several other researchers, nutritional biochemists, we want to look at if we modify the diet of patients, eating less fried food, less barbecue food, and eating more antioxidants, increase the intake of walnuts, berries, and putting them on some supplements like folic acid, could we perhaps slow the onset of Alzheimer's disease? So we're testing this in patients with what we call mild cognitive impairment, early stage of Alzheimer's disease that have yet to develop dementia. So we are at the stage of planning right now, and we are obviously looking for partners with us.
The kind of clinical, is this some of the research that you're doing yourself here in Hawaii?
This is happening right here in Hawaii. We're very fortunate. We have a good team of doctors, physicians, and PhD scientists we're working with from around the state, from several institutions, including University of Hawaii, and also the Department of Geriatrics, University of Hawaii. And so we're very fortunate the team are coming together, but we are not yet quite ready to recruit patients. We're in the final stages of planning for it. We're looking for partners to help us to fund this study that is work towards a lifestyle modification, dietary mainly. But this is part of what we call a larger study that we're looking at, perhaps lifestyle, perhaps later on, if the studies shows that by modifying the diet, it's good for the brain, perhaps exercising, aerobic exercise. We would like to carry these studies on. These are really easy studies to do that's not going to hurt us by living right.
Yes. I mentioned I was at the Kapi'olani Community College. We've got a culinary department here, which is pretty well regarded, and culinary. The specialty is known as culinary arts. Yeah, and the University of Hawaii has a food sciences department, and food sciences, of course, they deal with more of the chemical break, nutrition, the shelf life issues and that sort of thing. And we're doing some combination of food science with culinology, with culinary arts, and we're calling it culinology. Yeah, culinology. It's not the study of colon. but I'm telling our culinary arts people, you folks got to look at gerontological culinology. And it would be very exciting to look at this whole issue with reference to what you're doing as well. It would be exciting.
Well, we really think that the brain is an organ. It's like we are what we eat.
That's
basically.
right. Yes.
The brain is affected and basically made up of what we eat, and we believe nutrition could hold a key to prevent or slow the progression of dementia.
Oh, great. Now, I thought maybe we should provide the viewers with some contact information since we're getting pretty close to the end here, and maybe you could kind of share with us your contact information, your phone number.
Absolutely. We can be contacted at the Hawai'i Alzheimer's Disease Center, area code 808-261-4476, or on our website, the hawaiineuroscience.com.
Okay, so that's lots of information there for our viewers who probably will have lots of questions to ask your staff, you and your staff, and they can get that also at your website as well. So now we're getting pretty close to the end, so perhaps I should ask you if we've got so much information that you've provided us with, and there's even more probably that we didn't have time for. But if you had to leave one last tip for our viewers, people that are concerned about this issue, people are thinking about their loved ones, what would you tell them?
Colin, people ask me that question all the time. Is this ginseng works, all this supplement works, But let me just leave them with one tip. There's an interesting study that came out of Europe recently that shows that people who retire late tend not to develop dementia. And the studies are quite true, supported by other studies, that people with higher education, people who remain mentally active, tends not to develop dementia. So I really believe that the brain is like the muscle. The more that you use it, the less likely you're going to lose it. So I really encourage our viewers to be active, to stay mentally active, really to live pono.
Okay, so that's two things here. Don't retire, rewire. How's that? Huh? Rewire. And yes, so those are good comments and good suggestions, and I fully I think that this will resonate well with our listeners out there and viewers out there. So thank you again for joining me, Dr. Leo, on Alzheimer's disease, and thank you again for being with us during this program. Aloha.